My name is Michael Cho. I'm a physician at University of Reproductive Associates. Our philosophy here is always that, fertility is a long journey. We're really just guides and helping people along to help them get to where they want to go. Sometimes it's very long and tedious, but we're here to help people out as they need information. We tend to be more conservative than a lot of other centers, but we have very good success rate despite being conservative. Because our goal really is one child at a time. One of the things I work with in the center especially is regarding egg donation. Egg donation is a very interesting topic in that it involves not simply the woman and herself, but now you're having a third party involved trying to help her achieve her family. So our goal is to try to make the process as easy as possible and as patient-friendly as possible. We try to work everything within the parameters that are required by the FDA and Center for Disease Control, so that everything works out ultimately that they have the family and a child. In an egg donation cycle, compared to regular IVF, is in an IVF cycle, a woman using her own eggs is stimulated with medication and then transferred back into her uterus after the eggs has been combined with her husband's sperm. In the egg donation cycle, it's similar in that transfer of the fertilized egg is transferred back to the woman's uterus. However, that egg comes from a third party that donates the egg. It could be a relative or it can be anonymous. And the process is similar in either way. However, there's different preferences by the couple. In situations where there may be no sperm source, for example, a husband could have had a vasectomy and there's no way to reverse it, or it's a single woman who decides to conceive without a partner that's in the short term and she feels that she's getting older faster than she wanted to. We discuss sperm donation, and sperm donation has been used for a long time in the United States. You can use directed donors, meaning that someone who knows you, that you know that will be able to donate the sperm to you. We can then quarantine those sperms and then put it back into the woman. Or there's banks that we work with where the donor has been screened, tested, and we sometimes joke that it's much more information than any woman will ever get when they meet someone in a bar or through friends, because literally there's information about a person's education, their interests, their backgrounds, their intelligence, and you, in a way, picking DNA for your child. At URA, one of the unique things about us is that even though we're a group practice, treatment for patients are usually individualized. There are protocols to make sure that things are not missed, but however each patient are examined individually, and each treatment plan is planned individually. And therefore, patients oftentimes tell us that they don't feel like they're going through a factory, even though sometimes it seems like they're busy in the morning, but they know that their care is designed for what they are and who they are. And that's something we're proud of, that we're actually looking at each person individually and figuring out what works for them. Therefore, we individualize the treatments so we can optimize the therapy for the couple in achieving their families the fastest way and the most efficiently.